Miss.
Hey, Stace.
And hi, listeners, and welcome to the Digestible Podcast, where we bring you all the health and wellness information that you need in an amount of time that your busy day can handle. And we make it easily digestible. Get it?
So, Stacy, let's tell the listeners who we are talking to today.
Okay, so we are talking to Parth Patel, who I love listening to because he explains things so well and makes them easy to understand, which I think is so important in this world of health and wellness that just seems to get more confusing by the minute. Parth is a seasoned professional in the health, wellness, and nutrition industry, where he has been working as a functional medicine consultant and field trainer for a company called Designs for Health. He lives and works in the Chicagoland area, and he works with functional doctors and medical doctors to improve patient outcomes through supplements and nutrition.
Yes. And what did we talk with him about today? This is a hot topic. It's been for a while, and it's been a bit confusing, hasn't it?
Yes. So we're going to touch on two hot topics primarily. So the first one is collagen, which has been around for forever, and everyone seems to be putting it in their coffee and in their smoothies, and it's on all the shelves and in all the products. But what is collagen? Does it really work? Do we absorb it? What is it for? And who needs it? These areas seem to be very gray for a lot of people. So he gives the best explanation on collagen absorption than I have ever heard.
Yeah, I'm so glad to.
Yeah. And then the next topic we talk about is colostrum, which seems to be newer in the social media and health and wellness world. It actually isn't newer to those of us who've been in health and wellness for a while, working with functional or integrative doctors. They've been using it for forever, but I think it's just having its moment in the spotlight. So now everyone has a lot of questions. Who should take it and why?
Yeah. And I have to say, the whole idea of colostrum was a little bit off-putting for me for a while, but it's definitely interesting to hear about all of its benefits. And it's so beautiful. I think it's just a nice, not everyone needs to take it, but it's like, can be really helpful. And now I understand why. And so I'm a little less, grossed out. I'm sorry, I just had to say. And also, just for the record, like for a while, everyone's like, "Wait a minute, you can take collagen." No, you can't take collagen because collagen breaks down in your body, and then it's used for and then it's useless. But it's not useless; it's just different. And there's ways to take it that makes it much more useful for what we want it for, whether it's for your muscles or for your skin. So, great episode, and enjoy.
Hi, Parth. Welcome to the podcast.
Thanks for having me, you guys. I'm excited.
Absolutely. We're so happy to have you here. Okay, so I feel like you describe this topic better than anyone I've ever met. So let's start off with collagen. Collagen is everywhere. It's in everything. You can get it at any store, on any shelf, it seems like. Why is everyone using collagen? What's it for?
Yeah. So collagen is the #1 protein found in the human body. It helps our cells, but also organs and so many other things have structure, right? So it will help with elasticity, but also helping with strength, right? So it is very common to find it in foods. And the reason why we're seeing it so much nowadays is people are they're familiar with the benefits. And because of that, they think just providing collagen in any sort of form is beneficial, but unfortunately not all collagen is created equal. But another big reason is it's easy to work with, right? So you could put it in bars, you could put it in the powder form and dehydrate it. It doesn't change the format of the molecule itself, so it doesn't denature as fast. So it's easy to work with, and for that reason, you see it in so many different avenues, right? Like bars, drinks, things along those lines.
Okay. Now, there's a lot of questions about the different types of collagen. Type 1, type 2, does it get absorbed? Does it not? This one has Verisol, this one has Fortibone. What does all that mean, and does it really get absorbed?
Yeah, good question. So I want to start off with there are 28 different forms of collagen found in the human body.
Wow. I
Right?
didn't know that.
Yeah. So 28 different forms, but majority of the collagen found in the human body is type 1 and type 2. So type 1 and type 2 make up close to 80 to 90% of of what's found in the human body as well. So what is type 1 collagen? So type 1 collagen is going to be hair, skin, nails. It's going to be tendons, ligaments, vascular structure, organs. All of that is going to be type 1. And then type 2 is going to be more of the cartilage caps, right? So more joint health. So when it comes to how is it absorbed? Is it absorbed? I think that's the most important topic to talk about when it comes to collagen. So there are a lot of different ways you can cut the collagen. When it comes to retail brand collagen, things you find on the shelves at like Costco or Walmart or some of these other places, they use a cheaper process called steam hydrolysis. So think about it like you take a big rock and a sledgehammer, right? And you try to break the rock apart. And what you will find is you have small pieces, you have some medium pieces, and some very large pieces. The small pieces will get absorbed as collagen, but the medium pieces and the large pieces, a lot of times due to the digestive tract, will get broken down into amino acids and protein. So it's not necessarily bad, but if you're going to pay collagen prices, and you should be getting the benefits you want, right?
Okay, so when you say that sometimes collagen doesn't get absorbed, and I'd heard that before, it's still getting absorbed as something else. It's not a total loss, but you're getting it as protein and amino acids, not as collagen, but you're paying for the collagen prices.
Right.
Okay.
So on the other hand, so professional companies will use patented raw materials, and a lot of them, the gold standard is a company out of Germany called Gelida, and they have patented a process. It's called enzymatic hydrolysis, right? Okay. So what they pretty much do is they are able to cut the peptide, the collagen peptide, into very uniform pieces. So think about it like a pearl necklace, right? Every single piece is the same size. And for that reason, we're able to show that it does get absorbed at the gut level, and it's able to actually navigate to where we want it to go, right?
Okay.
Yep. So
we need to look for that on, like, will it say it on the container?
So a lot of times it will give you patented ingredients. For all the professional brands, it will definitely give you the patented ingredients. Some of the retail brands, a lot of times, will give you a proprietary blend, but a lot of times won't label exactly what form of collagen or how much of it is actually in there. It will just say collagen, 25 grams, right?
It will say how it was extracted.
Right.
Okay. And what about those patented brands? What are the differences between those?
Yeah, good question. So there are multiple different patented peptides you could have. Some of the ones that I'm very familiar with one is called Fortibone. And this one is one of my favorite peptides just because there's so much research done on it. And pretty much what Fortibone goes after is helping turnover of the bone matrix, right? So what they actually were able to show was they radio labeled the collagen to show, does it actually get absorbed and where does it actually go, right? So Fortibone is a type 1 collagen. And what they were able to show was not only did it get absorbed in the gut, but it went to the bone matrix where we want it. And when we think about bone traditionally, I think most of us focus on just the density of bone, right? But bone strength is made up of two different things. One is density, and the other one is more flexibility, or how much give does the bone have without breaking it, right? That's the other side of bone strength and bone health. So with collagen, we were able to show, because it stimulates something called osteoblast, it's able to have turnover of bone. So we're having better flexibility of bone as well. And there are multiple studies done where they gave Fortibone, that exact raw material I'm talking about, to menopausal women. So women above the age of 65, I believe, were looked at in this group and in this study. And what they found was 75% of the group that was given Fortibone actually had a significant difference in the bone matrix. So they saw a result in an outcome. So
Wow.
We have something called hydrolyzed collagen in our house, and I was told by a dermatologist that that's a good one to take. What does that mean when it's hydrolyzed?
yeah. So hydrolyzed pretty much means it's broken down into absorbable pieces, but hydrolyzed does not mean it's very bioavailable. So both processes, whether we're talking about steam hydrolysis or enzymatic hydrolysis, you could still say the protein or the collagen is hydrolyzed, right? So it it means it's broken down, but we don't know if it's broken down into small enough pieces to actually get absorbed as collagen and be used for different things that collagen might be used for, right?
So it's like not quite enough. We need to see something else on our packaging.
Yeah, yeah.
Okay.
And it's hard to just read the label and determine whether it's a therapeutic collagen or not, right? Some of the things to look for is the sourcing of collagen. So it is a bovine source, right? So you want to make sure it's grass-fed, pasture-raised, no antibiotics, things
Love
along
to hear
those
that.
lines. Yep. So that would be kind of the raw material side of things, but then the processing is also very, very important. And it's hard to determine with the retail brands what process it goes through. But I could confidently say all the professional brands will always use enzymatic hydrolysis.
Okay, so you want to look for enzymatic hydrolysis.
Yeah, grass-fed, the sourcing of the raw material itself before it was hydrolyzed.
Okay, thank you.
Yeah.
Okay, so you just told us a little bit about the Fortibone. I've seen Verisol and I think a couple other brand names on the backs of collagen, and I can't remember which ones. Can you speak to those two? Like, what are those for?
Yeah. So Verisol is again another type 1 collagen, and it goes after hair, skin, and nails. So traditionally, a lot of times we look at beauty and we try to take the approach of outside in. So like a lot of people do fillers and they'll do different injections, PRP, a lot of different lotions, right? And that is supposed to stimulate collagen production a lot of time. Like that's what PRP goes after, is we're breaking down collagen in the skin, so we lay down new collagen that might have more elasticity, right? So that is the approach we currently take. I would argue that taking a inside out approach with something like collagen, knowing that we lose 1% of collagen after the age of 35 every single year,
Wow.
by supplementing with collagen, like a Verisol, you're reducing the percentage that is degraded year over year, right? So instead of losing 1%, you might lose 0.5, you might lose 0.4, right? And because of that, elasticity will be a lot better, skin health, you'll be able to notice wrinkles are not progressing as quickly as they once were. And also for hair, skin, and nails, that's another huge place where, in particular, women will notice the difference more than men because they're just more conscious about things like that. But yeah, shows huge benefits, and I genuinely believe that's where like collagen, the topic really started to become a bigger conversation than it was, and it was because of the cosmetic benefits.
Okay. I've also seen some that have chicken comb in them. Um, is that for the joints?
Yeah. So there is a ingredient called Fortigel, and then there's other ingredients that might be like Mobile E. Those all go after joint health. Fortigel and Mobile E, they are both type 2 collagens, and they're found in cartilage caps, so in joints, right? And because of the degradation of collagen year over year, you start to have inflammation, but also you're not recovering as fast, right? So what we have shown with Fortigel is, again, not only does it get absorbed, but because it's a peptide, we were able to show that it navigates, again, to the cartilage cap to help rebuild cartilage at the joint level. But because it's a peptide, it's able to signal to the body to make endogenous production of collagen. So your body
What does
is,
that mean?
yeah. So your body is not only getting an outside source of collagen, but because of the signaling, your body is making its own production to help with joint pain and cartilage.
Okay, so we know which ones can absorb and which ones can't absorb as well, and we know all the different things. Is there anything else collagen can do that we haven't covered?
I think overall prevention is going to be the most important thing here. And I also get a lot of questions of like, when do I take it, right?
Yes.
So when it comes to collagen, it's not about a when, it's more about how consistent you are with it, right? So you could take it in the morning with a smoothie or put it in your coffee or oatmeal, however you want to do it is completely
Don't
okay.
put it in your tea. I tried. It doesn't taste good in tea. Just FYI.
Good to know. I'm gonna try it in my coffee, I think.
Yeah.
I think a lot of people put it in their coffee and like it. I just don't drink coffee, so I'm like, I'll try and put it in my tea. Yeah.
Sure.
I
No.
put it in my smoothies, but I don't have a
I do
smoothie
too.
every day, so
Yeah.
maybe I should just put it in my
And-
coffee.
Yeah,
Yeah.
and ideally in a warmer liquid, it dissolves very well in anything that is warmer. If you are putting it in like a shake or something, you should probably have a shaker bottle or use a blender. That way, it's actually being broken down and getting into the smoothie, and you're not having clumps. But anything in a hot liquid, it starts to dissolve right when you put it in.
And it doesn't affect it negatively to put it in hot.
It doesn't degrade the protein, no.
Okay.
So you'll still be able to get the benefits. I have some doctors that cook with it. They'll make like muffins with it, and there's recipes
Interesting.
out there. Yeah,
Mm.
so
you really
can
can put
even,
it in anything,
yeah,
especially if it gets warm or it gets mixed real well.
right.
Okay.
Okay, so we can put our collagen in anything other than tea, and it's good in coffee. Is there a time of day that you have to take it, and do we have to take it every single day?
Yeah, so time of day really doesn't matter again. You could take it in the evening time. It's just protein at the end of the day that is broken down into absorbable pieces and used, right? So timing is not so important, but regularity is, right? Making sure that you take the therapeutic dose on more of a consistent basis. Sure, you could skip a couple days here and there, you're traveling, but if you do it often enough, your body starts to utilize it and you'll see better benefits long term. So like when we're talking about osteoporosis, right? Like that is something that is hard to reverse. So taking a preventative approach would be probably the best thing for bone health. And when you consume collagen every day, you're having turnover of bone, right? And because of that, your bone mineral density will probably be a lot better, but also like we talked about, the flexibility of bone, that little give that it has will also be a lot better. So consistency is better than anything else when it comes to timing or things along those lines.
Okay, but regular use is important, consistent
Yes.
use.
Very much so. Yeah.
Okay, great. All right, are you ready to move on to our next hot topic?
Let's
Okay.
do it.
Let's do it. Okay, colostrum. So those of us who work in healthcare obviously are familiar with colostrum. It's been used for a long time for some very specific conditions, but all of a sudden it's having its moment because every celebrity is like, I take colostrum and I take colostrum and it's expensive. So tell us what colostrum is for and why you think it's having its moment right now.
Yeah. So what is colostrum, right? So colostrum is mother's milk. It's made by all mammals, and it is made right after giving birth, right? And the purpose of colostrum is it is a lot different than normal milk. It's higher concentrated in something called immunoglobulins. These are like antibodies, right? But it also has other components like insulin-like growth factor and different components that will help with passive immunity at the end of the day. So it's designed to get from the mother and give to the child while they're very, very young and don't have the immune system that you need to fight off some of these bugs and viruses that they might come in contact with. So all in all, it is designed for increasing passive immunity. And I believe the reason why we're hearing about it, again, very safe ingredient. It doesn't really cross into the body. It stays at the gut level. So most people can take it, see good benefits without many of the side effects that you might see with other nutritional compounds, right?
Right. Oh, we should probably pause for 1 second just to make it clear that the products that are on the market are bovine. So it's cow's milk, colostrum,
Right.
not human or anything else.
Right.
Yikes.
And Missy, you had a question about that.
Oh, yeah. So, from what I understand, my limited knowledge, colostrum is what comes out first. So I worry about the calf. So if we're gathering this nutrient packed colostrum from the cows, are the calves getting it too? Because I feel sad for them if we're stealing it from stealing it from them. Sorry.
That's a very good question, and so the place we get it from is called the company is called Tegracell. They're out of North Dakota, if I'm not mistaken, and they actually came and talked to our company, and someone did ask that question, and they told us their cattle and the baby is the most important. The business comes afterwards, right? So they make sure that the baby has enough, and they do not actually take from the mother for the first, I believe, couple of weeks that the baby is first born. So the baby is getting enough, and the surplus is used to make these products. It is not taken away from the baby itself.
Glad to
Oh,
hear
good.
that. Thank you.
Absolutely.
That makes us much happier and feel much better.
Yep.
That's a good question. It's an important question. So, okay, so it stays at the gut level. And then what is it doing for people right now? Like, why is it like all the rage? Is it doing something for anti-aging if it stays in the gut? I don't understand.
So all in all, the mantra of functional medicine is start with the gut first, right? So when we're talking about inflammation, a lot of inflammation that's localized at the gut does cross the body and become systemic, right? So it does cross the blood-brain barrier, it goes into different parts of the body, and increases systemic inflammation. So by controlling the gut level inflammation with these immunoglobulins, we're able to reduce systemic inflammation, which will ultimately help with anti-aging and so many different things, right? But all in all, the mechanism of action of colostrum is it sits in the lumen of the gut and it binds on to things, right? So it will bind on to E. coli, it will bind on to LPS, it will bind on to gram-negative bacteria that are causing damage at the gut level and increasing that inflammation. So by reducing these bacteria and pathogens, you're able to give the gut time to heal itself naturally, right? So it's going to heal itself, and because of that, you'll see a ton of different benefits from digestive health to brain health, right? By reducing inflammation, you will see all of these different benefits that we might not associate with the gut, but there's so much research coming out about the gut-brain barrier, right? So a lot of that points to gut health, and colostrum is something that you could definitely use to manage GI conditions and issues.
Okay.
Is it meant for long-term use?
It can be used long-term. So I obviously a lot of clinicians that we work with see autoimmune conditions, right? And many of them might be on an immunosuppressant or don't want to go on something like that. So they will use colostrum, and again, because it helps with passive immunity, you're not getting these co-infections that you would normally. So it can be used long term, and the benefit is you're not going to get sick as often as you once did, right?
Could you talk about that really quick? Co-infection? What do you mean by that?
Yeah. So, I mean, when you are immunosuppressed, when you come in contact with any sort of bug, right, because your immune system is fighting itself / trying to figure out what is going on in the body, it's not able to deal with the bacteria or the pathogens that we come in contact with. So when you're immunosuppressed, naturally co-infections, which are just normal bugs that most people could fight off, might cause you to get sick more often.
Okay. So, one of the things I'm learning in this whole process is that our bodies are constantly, we always have in us things like E. coli, and we have yeast and other types of living things that are usually under control. Like our body just keeps the populations down. So, are you suggesting, or is the science saying that when we are inflamed in our gut, our body isn't able to sort of maintain all of those populations, and so the colostrum helps with that?
That's exactly it. Yep.
So, like on a day-to-day basis, taking colostrum can help you sort of stay healthier because it sounds like it keeps the bacteria that could get in the way of being healthy. Like it just keeps them at bay. But if you have an infection or you have gut inflammation, which can then become systemic, the colostrum can actually give everything a break so that you can heal.
Exactly. Yep.
Wow. Cool.
Right. Right.
So, in our clinic, I have seen and met some patients who take colostrum long term, and some of the things I've heard them say is like, one of them is a teacher, and she's like, I never developed the immune system of a teacher. She's like, I would get everything the kids brought into the classroom, and I think most teachers over time kind of build this like superior immune system. But she's like, I just didn't. And the doctor put me on colostrum, and I will never stop taking it. She's like, because I haven't gotten sick since I started taking it.
Wow.
I'm like, wow, that's a great story. And I have met people who have gut issues who take it long term, but a lot of them do tend to stay on it really long term. I don't know if it's because they're supposed to and that's what the data supports, or if they're just scared to go off of it.
Right. I think that's probably the number one use for it is GI issues, right? So there's also a lot of evidence showing that it helps desensitize food sensitivities, right? Because at the end of the day, you have this IgG, which is the immunoglobulins that are naturally found in colostrum, binding on to undigested food particles. But naturally, colostrum has other components, like I was saying, like the insulin-like growth factor, which will help the enterocytes or the gut lining start to heal as well, right? So we're healing the gut lining while reducing the toxic burden on that lining as well. So we're putting out the fire while starting to rebuild. So GI function, that is the number one indicator and the number one use for colostrum. But because we're able to reduce the inflammation, you will see so many benefits throughout, right?
So everybody does not need to be taking colostrum.
No.
Okay. Because it's all over social media, and I have so many people who reach out to me and they're like, do I need to be taking colostrum? And I'm like, I don't think so. They're like, but all the celebrities are taking it. I'm like, I'm not sure you need it.
Maybe they all have gut issues. It's a very stressful business.
It's possible.
Yeah. So if somebody wants to take colostrum, they've decided this is what they want to do, how do they find like a good reputable product? Because it seems like there could be a lot of room for bad products.
Yeah. So again, sourcing is probably the most important. So we use grass-fed, antibiotic-free, pasture-raised. So that is going to be very, very important. But also standardizing the colostrum to the active components like we talked about, right? The immunoglobulins, how much of it is these immunoglobulins? There's something called lactoferrin in there that binds onto iron that is used by viruses, right? So the sourcing is very important, but also standardizing it to these active components is also very important. So
it needs to have lactoferrin in it too.
Yeah. And it naturally does, right? Colostrum will naturally have lactoferrin, but how much? How much of the IgG is in here? So when you go with a professional brand, like Tegracell has 40%, it's standardized to 40% IgG, which is the immunoglobulins. So again, the better professional companies will standardize the active components while some of the retail brands might not be doing the testing or standardizing those things that actually do all the work in colostrum.
And how do you take it? When do you take it? When would you expect to see some results? I guess if you have food sensitivities or gut issues or immune issues, is it like 30 days you'll start to see something?
I think even sooner. So if you're dealing with like diarrhea or loose stools, you'll notice something within days, right? Within 3 to 5 days, you'll notice that, hey, my GI tract or my gut doesn't hurt as much. Inflammation is going down, but also the consistency of stool, right? But you could, yeah. So short term, you will notice a difference. And when it comes to timing, again, much like collagen, timing is not the most important thing. It's the consistency. It's how often are you taking it, because it will stay in the gut for a period of time and then it does get secreted out, right? So if you are replenishing it consistently, you will have those benefits for a longer period of time.
Okay. With food, without food, morning, evening, does it matter?
Morning, evening doesn't matter, and you could put it in your smoothie. So with food is not a problem at all. Without food is not a problem. Just get it in your body is the most important thing.
Okay.
Great.
But not everybody needs it.
Nope. If you have good GI function, you're taking a probiotic, you don't have to take colostrum. It's really designed for anyone that is dealing with an autoimmune condition or an immune challenge, or is having a lot of inflammation, SIBO, GI conditions. Those are the candidates that should be taking colostrum. But if you don't have any gut issues, I would say don't take colostrum. Let your body just regenerate naturally. Let it do its thing, then add things that it doesn't really need.
Okay. So this is not a social media trend that everyone needs to jump on.
No.
All right, good.
Parth, thank you for being here today. What would you like our listeners to take away from today's episode? Is there one change that they can make after listening to our conversation?
Yeah, I would say probably the most important thing is consistency with lifestyle, but also diet and nutrition, right? If you are not consistent, you will not see the results long term. A lot of these issues and dysfunctions took years to manifest. You can't expect them to change within 7 days or 30 days. It does a lot of times take a longer period of time. So being consistent overall will give you the best benefits long term.
That's actually great advice, because I think people do get frustrated. They try something new and they expect it to be like overnight. And it's
Right.
like, no, you got to do this for like a couple months. And
Yeah.
then maybe we'll
Right.
evaluate.
That it does take a lot of patience and dedication to be that consistent, but it's obviously it'll pay off.
So collagen, take it, reassess 90 days.
Yeah,
You should see something good happen.
absolutely.
And colostrum, if you need it, you should see something kind of quickly, it sounds like.
Yeah.
Which is
Especially
nice.
if you're dealing with gut issues, you should see some sort of benefit within even a week.
I'm sure that's very reassuring to those who are suffering. So thank you.
Yeah.
Yeah. All right. Our last question for you, Parth, is here at the podcast, we always say, don't panic, just pivot. Can you share with us a positive change that you've made in your life that you are proud of?
Yeah. So I've been meditating on and off for a number of years, and it feels like whenever I need it the most is when I'm not doing it, right? Unfortunately. So this year, again, I have reincorporated it into my morning routine. I usually do 20 minutes right before I leave the house for work, right? So being more consistent with that has been a huge win, and it is paid. I mean, I sleep better throughout the day. I'm just more calm, right? So I would say that has been the number one thing I've noticed a difference with this year that I'm happy that I'm doing again.
That's amazing. I have to
that's
say,
a great one.
that's always my New Year's resolution is to meditate like every year, and I never do it. And this year I started doing it, but like I'm so impressed you do 20 minutes. I do 5.
Yeah.
sometimes maybe 7. And it makes such a huge difference. But
Totally.
20, okay, that'll be my next new goal.
Yeah,
Yeah.
next pivot.
Yeah. And then I was just going to mention what I found is sitting at the same place at the same time, listening to the same thing, just makes it so much easier to get into that state, right? For me
Ooh.
personally. A lot of times, if I change the music or if I change places, if I'm in a hotel, I just notice that my mind is not calm. It's still running around doing what it normally does. So to have better results with meditation, what I've found for myself is same time, sit in the same place, listen to the same music if you listen to meditation music while doing
All right, that's good advice.
Yeah, it is.
Thank you.
it. Absolutely.
Thank
Thank
you.
you so much. Thank you so much, Parth. This was so fun.
Thank you for listening to the Digestible Podcast with our special guest, Parth Patel. If you like today's podcast, please share with others. It's the best compliment you can give us. If you have any questions or comments, you're welcome to contact us at info@digestiblestrategies.com. We look forward to hearing from you. And remember, don't panic, just pivot. The content shared on this podcast is for informational and entertainment purposes only. We are not medical professionals, and the views expressed here are not intended to diagnose, treat, or cure any health conditions. Always consult with a qualified healthcare provider before making any health-related decisions.